This week on Ryan and Megan, we discuss why we choose a HealthShare to cover our medical needs as travelers.
Welcome to episode number 14. We are Ryan and Megan, two traveling physical therapists. We've been traveling since 2020, and we are now traveling with our two little children. Today, we're going to be talking about HealthShares, which one we use, why we picked it, some details, and hopefully it's really helpful. We got a question about it this week and actually really motivated us to go ahead and make this and answer as many questions as we could.
Yeah, I think most people have not really looked into HealthShares. You know, you've heard about them. You've heard of MediShare. I'm trying to think of some other big ones as like an option for covering some of your medical needs. But a lot of times people just take whatever their workplace gives you. And as a traveler, that's no difference. I mean, our travel companies offer us medical insurance. And so, but we've kind of taken a different route. So we're going to discuss through that. But before we hop into that, if you could just consider giving us a 5-star review on wherever you're listening to this podcast, on Spotify, Apple Podcasts, wherever, just give us a 5-star review. That really helps boost our podcast to more ears, and we would greatly appreciate it.
Yeah.
So let's kind of hop into it. Let's first explain kind of what is a HealthShare.
A HealthShare is a cost-sharing community. You pay a monthly fee to be a part of it. Usually there's a couple rules that you have to adhere by to be eligible to stay in the group. And when you have a medical need, they help cover that cost. They're not health insurance. It's basically just a big group of people putting money in a pot and saying, if you have an issue, we'll pay for it out of this pot.
Yeah, I think that's like the most simple way you can describe it. When we talk to anyone that is interested in the HealthShare and kind of why we choose it, the best way to explain it really is like it's just a group of people that pay a monthly fee into a big pot of money. Mm-hmm. And then when you have a medical need arise, you take a little money out, or you submit a need to get that need paid for out of that pot. Mm-hmm. So that's really important because, you know, we're really going to harp on that this is not considered medical insurance by the government, by anyone. It's not medical insurance. You're kind of foregoing medical insurance for this HealthShare, which is a separate thing. Mm-hmm. The problem is it operates very, very similar to health insurance.
Well, also, I think a lot of people just are not like familiar at all with how paying happens when you have medical issues. You just like go and get your stuff done and then like worry about it later. And you're not really involved in like, what's the cost for this service and what's the cost for this, or who's paying for it? Who should I go to? And I'm not saying that you have to like really think through all of that stuff like crazy to be in a HealthShare. It's just, we're very unfamiliar with like paying for our services.
Right. I think,
in a sense,
you know, before we had the HealthShare, it was very common for me just to think that my health insurance, I'm paying for health insurance, so it should cover everything. And that is not the case.
No.
And a lot of people find that out because they're like, oh, I only get 2 visits for this specialty, or, oh, you're only covering 80%, or I have to pay this big deductible this year.
Right.
So there's a lot of nuance to it. And that's what I've really liked about the HealthShare is it's very straightforward. Simplifies it. And you don't have to play the insurance game.
No.
And so that's probably the number one thing we like about this is we don't have to play the insurance game in this HealthShare because it's not health insurance. It's something different.
And as healthcare professionals, we know how tricky it can be to deal with health insurance companies and all of their different requirements and things like that. So being on the other side as a consumer, knowing that my like healthcare providers don't have to worry about all of the weird insurance things. They can just provide me care that's appropriate and I can pay them for it is really nice. You know?
It is really nice. So that's kind of our basic breakdown of like, what is a HealthShare? There's tons of HealthShares out there, some good, some bad, just like health insurance. There's some good, there's some bad. But we're going to kind of discuss from our personal experience with one HealthShare company. Mm-hmm. It was the first one we chose, and it's been wonderful.
We cannot say enough good things about it. honestly. I hope somebody from Zion kind of hears this just to know how much we like appreciate the company.
And that's the other thing is we are not affiliated with this HealthShare company.
No.
They are not paying us
Just
anything.
consumers.
We just use it and we really like it. And we think it would be very beneficial for other travel therapists and especially other travel families if you're looking to grow your family.
Yeah.
We've been a member since 2021. And like Megan said at the top of the show, we started traveling in 2020. So we've been with them pretty well our whole travel careers.
So we've been with, I don't think we've said it formally, Zion HealthShare is the name. It started in 2019 and it's grown to be like the fastest growing health share in that space. They've covered lots and lots of billions of dollars of cost in health needs, and their customer service is top notch. I would say that is one of the biggest things that stands out to me.
And you never hear anyone say that.
Never.
That their customer service line is wonderful. Like literally when we say you can just call them and ask them a question like, do you cover this specific thing that I have? Go ahead and call. Or if you need to figure out like what is the best plan or how does this work? We have called them multiple times. We always get a human representative. And they help us out, right? Like that. There's no long wait lines. It is literally the best customer service I've ever called.
They've sent us flowers both times we had our babies. And that was super unexpected. The first time I got it, I was like, I don't even know who this is from. And I found out it was from Zion. And I was like, whose insurance, if that's your other option, would ever send you flowers for having a new baby?
So let's get into the next question. Usually people ask us once we kind of explain that we use we use Zion HealthShare is what do they cover? Because everyone's really worried about not being covered for something. And so that's a really good question to ask of kind of like, well, what does the HealthShare cover? I've heard bad things about them, that they don't cover hardly anything. And again, we're kind of talking in with Zion and we're not experts, but
no.
We'll give you the resources at the end. We'll link it down in the description on everything they cover. And then again, do your own research on what Zion covers, especially if you have certain niche things, because they don't cover everything. Just like health insurance doesn't cover everything, but they cover a lot of your basics. So they cover like your medical emergency trips. They cover I'm going to look at our list, your preventative and routine visits. So your routine visit to the doctor. What else would fall in that? I know like the girls, when we first had them born, they have so many routine visits as infants. They cover, a certain amount of those.
Yep. They cover visits like mammograms. They'll even cover certain like things that might be considered pre-existing conditions to other insurance or health shares, like hypertension and diabetes and heart disease, I think. But essentially what they are there for is for like a big medical need that's unexpected. That's usually where you would incur the most cost if you had insurance or if you had a health share. But in the health share communities, they really kind of promote like living a lifestyle that keeps you healthy. And it's kind of nice to know that everybody in the community is trying to do that and stay healthy. So you know kind of where the money is going towards, but they implement certain things to promote that. So when a big thing comes up that's unexpected, like a broken bone or some sort of weird freak accident, that's what they're there to cover for. And then basically from there, it's just annual visits. So you get one annual visit a year, like a primary care visit, get a mammogram. I don't know.
Yeah. So your preventative routine visits, they cover, if you need to take an ambulance to the hospital for that emergency, your labor and delivery, if you're going to have a child, they cover your rehab facility. So therapy, that's us.
They'll cover equipment and medical supplies.
DME. So very, like we said, very similar to what you would have with your insurance. There's little caveats on there on what they will cover and what they won't.
They cover
the main things. Yes, prescriptions is a big one. So like we said, it operates very similar to health insurance. It's not health insurance, but that kind of eases people's feelings around it once they kind of know like, okay, this these things that I know are important to me are covered. And again, look at our membership guide. We'll leave a little link to a PDF down below, or the website. We'll send them over to their website, and then they will have more specific on what they cover.
Mhm.
And they have it laid out on their website actually really nice. It's not like you're reading a bunch of fine print and legalese.
Mm-mm.
It's like very note like, hey, do you cover, breast cancer screenings? Do you cover, and they explain it. So it's actually a really easy read to go through. So as with every health medical insurance or HealthShare, they're not going to cover certain things. One of the things we've noticed that they don't cover is like vision and dental.
Mm-hmm.
So they're not going to give you those benefits, but that's really no big deal because we just take those through our travel company. We will waive or we will put off the coverage for the medical. We'll say, nope, we don't need your medical insurance, travel company. We have our own. And then we opt into their vision and dental plan, which usually is only a few dollars
Yeah,
per
usually
paycheck.
very minimal.
So it's not very much. And then we carry that insurance through there. Now, when we are off contract, so in between contracts, we're off, we're not covered with vision and dental. So we make sure we do all of our vision and dental appointments kind of while we're on contract and covered.
Mm-hmm.
If for some reason an emergency happened, I got hit with a softball in the eye or something like that, again, our medical insurance will cover those emergencies.
Mm-hmm.
It just won't cover like if I had Lord forbid, like a root canal or something, I needed to go directly to the dentist until I'm covered on there. So
yeah,
something to think about.
Yeah. So what else we do for those things that are not covered is just pay for it out of pocket. So that's something you kind of have to know when you're opting into a HealthShare, is that you need a bit of a reserve saved up for things that they are not going to cover if you're planning on using it.
Right. But make sure you read the on there what they cover so you can prepare for that.
Yeah.
Because they do really cover most things that normal health insurance covers.
The next kind of question we want to address is, how do you submit a need? What does that whole process look like when you do need to use your HealthShare? Because it can be kind of confusing and foreign. It's just a different process. So basically how it's worked for us, and what we do, and again, we're not experts because we have made mistakes before, but when you have a need, usually it's an emergency. So like this past year, our daughter broke her leg. And we used our HealthShare for that, and it was a really great process. But basically you get your care and receive your care, and you're going to be paying for a certain amount of that care until, or you are going to be paying for a certain amount of the care before your HealthShare benefits kick in.
Yes.
Very similar.
This is what they call that initial unshareable amount. Very similar to what a deductible is.
Mm-hmm. Yep. So for our plan, what we've opted into, it's $1,000, and we're going to kind of go through kind of the cost and the other plans that they have. But, ours is $1,000, so we paid the first $1,000 of bills, and then the rest of the bills we submitted to Zion. They also have experts on hand at Zion that you can ask to help you with like negotiating your bills or finding care that's affordable. So if you have a big need and you're nervous about what they're going to cover or how much it's going to be, you can call into Zion and ask to collaborate with some of those specialists. But they covered everything. They covered our ER visits. We had 2 because we were sent to another ER. All of her aftercare for the casting, and then therapies afterwards as well. And that was all under one event.
Yeah, like healthcare episode was under one event. And a lot of times when we go in, they ask you like, what is your insurance? What we tell them is we're self-pay.
Because we don't have insurance.
Right, because we don't technically have insurance. And so you tell them you're self-pay, because then they don't have to run it through like this insurance where like the insurance, they charge this high rate because the insurance only pays them 25%.
Right.
They don't have to go through any of that. They have self-pay rates, which is a lot lower. So you tell them, nope, I'm self-pay, just bill it directly to me.
Mm-hmm.
You don't have to tell them you're a part of a HealthShare because they'll get all confused. Don't do that. You just say you're self-pay. That bill's going to come to you with your name on it.
Mm-hmm.
But again, you're going to pay those bills up to whatever your unshareable amount is. For us, it's $1,000. So we cover $1,000 for that one episode event. Then anything after that, we submit a need through the website or to Zion, and they get back to us. And that looks like in a form of either they just go on to the medical thing and they pay for it, or sometimes they'll give us like not a company credit card, but a special credit card number that we can then use to pay for our hospital needs. And then they pay for the rest of it because that's one hospital need.
Sometimes it's a reimbursement if you paid extra, like too much, or if you just went ahead and paid a bill, you can let them know, hey, I paid this one, but I've already met my initial unshareable amount, so I'll need it reimbursed. So it'll be through all those ways.
Now that $1,000, you have 3 of those per year. So you have 3 initial unshareable amounts not per year, but per rolling 12 months. So say Reagan, she broke her leg in February, and then the next 2 weeks, I broke my leg, and then Megan broke her leg. Those are 3 separate medical events, and we have to pay $1,000 for each of those because they're separate medical events. Now, say Megan didn't need therapy on her broken leg, but I needed therapy. Again, I will have already paid my $1,000 and the rest is covered. For our plan, once we hit 3 of those unshareable amounts, so $3,000 total in a 12-month rolling calendar, then anything past that, they pay for.
Right.
So very similar to health insurance, how you have like your initial deductible and then you have like your out-of-pocket max. So for us, that would be, like $1,000 is our deductible. Our out-of-pocket max is $3,000 every 12 months.
It's pretty clear cut. A lot of times people ask us questions about things and they're confused because they're used to so much more going on.
So much more behind the scenes details. And this is the part where like Megan was talking about where you have to save kind of some money for a reserve. So we know that our deductible is going to be $1,000 and there's a chance, if, Lord forbid we have something, boom, 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 we could be up to 3,000. So we make sure our emergency fund can cover that with ease. Just because, you never know when you're going to have a medical event and it doesn't quite break your 1,000 or, you have to spend that 3,000. So we have enough money that we can pay for that. Because the other caveat to this is like one time, I had to go to the hospital. I was having a hard time breathing. And so I went to the emergency room. That's a big bill. And then they ran a bunch of tests. That was a big bill. But the bills landed at about $800 that I had to pay. Well, it didn't break that $1,000 threshold. So I had to pay for that full $800. And that did not count towards one of my like unshareable amounts for that year. So those are some things you got to have some money for to be careful with. Again, very similar to health insurance. You're going to have your little health insurance card. It's going to say, you go to the emergency room, boom, and your copay is $300. This is kind of how it operates a little bit differently on those amounts, but it's a lot more straightforward of, okay, anything under 1,000, I got to cover. Unless it's like a preventative event or like a routine visit. A routine visit, Zion's very straightforward on, we cover this many visits. You don't have to pay anything, that type of stuff.
Yeah.
How do we do the, explain to them how we do like the prescriptions when we need to get those?
Yeah. So prescriptions, they're like under this certain coverage that they use called like HealthShare or something. And so usually, over-the-counter prescriptions are extremely discounted. And I've only ever paid like $15 for a prescription. So
yeah, it varies with each medication. So you might want to check into that, but it really is kind of just like a discounted, prescription share kind of thing. It doesn't necessarily pull from their share. It's like a separate program.
And for that one, right, for the prescriptions, they kind of do have a card that is similar to an insurance card that you tell the pharmacist and then they'll call the RX share like a separate entity of the company or separate company they're partnered with. And then the pharmacist will get all the information and just tell you what your copay is. So there's no turning in a receipt for your prescriptions
Right.
or telling them the prescription costs $500 and then getting reimbursed a certain amount. It's very easy to
It
use.
operates very much like vision and dental. When you have those cards and they're kind of on their own little plan,
Yeah.
it works very much like that. But it's a part of your Zion thing that you get. So just know how that operates a little differently.
Yeah. And then maybe we can just touch a little bit on how it worked with pregnancy, just because that's our other experience and it's a little different.
And I think that would be great because that is why we went to a HealthShare. And I think the people who reach out to us, a lot of times this is, they're a couple and they're thinking about having a kid and they've heard us talk about how we're on a HealthShare and that's what works best for us because as when it was just you and I traveling, it was a lot simpler. We could just go on to the travel company's health insurance and then, we would switch companies, but we'd go right into the next travel contract. We were covered by Cobra for that maybe little bit of space. And if you don't know what Cobra insurance is, that's just a really expensive kind of retroactively insurance, meaning if for some reason we took off a week or two between contracts and I broke my leg, I'm covered, but my premiums are going to be very, very high, but I don't have to pay for it unless I break my leg. It's retroactive. Not suggested, but that's what you can do is you can kind of, you're only going to be off for a week or two. And so then you would go right into the next plan. So that's all we did. That's what most independent solo travelers or team travelers do.
We were more comfortable doing that when it was just us two, being okay with a couple weeks or, a month of not being covered with health insurance.
But then we decided, we wanted to have a family. And so then we were about to introduce, kiddos to the world and we needed to cover them. And we wanted to take more time off in between contracts. So using the Cobra, you kind of feel okay with it. Maybe 1, 2 weeks, 3 weeks is pushing it. But anything past that, you're playing with fire there. And so that's when a lot of times travelers look at these alternative options outside of their travel company, whether that's going to the marketplace or going to a HealthShare. And there's a lot of great resources out there. By no means is the HealthShare the cheapest option you can find. There's a lot of great loopholes with the marketplace and some government things and things you can do with your income, which is kind of interesting. But I will say, from our experience of taking the travel company's insurance, the HealthShare does seem to be cheaper, and we're paying for a full family plan on the HealthShare. So it was way cheaper when it was if it would have been just you and I.
Yeah, it definitely, when we were comparing cost for our plans when we were working travel contracts, Zion was like, what? Is it really?
Oh, yeah. It was like,
is it really only this?
It was like half of what we were paying.
Yeah. It's pretty crazy. And with a lower out of pocket max, essentially.
Yes. Yeah.
Yes. So with pregnancy, there are a couple things you want to make sure you are with Zion HealthShare for a certain amount of time before you get pregnant. Because if you are pregnant already and get on with Zion, usually it's not shareable because it's considered a pre-existing condition. A lot of other people and companies do that.
Yep, a lot of companies do that. So if you are a couple that is considering having a kiddo, really look at what their standard is, or any HealthShare, but specifically on Zion's, on how many months you have to be a member before.
Even insurance does that.
Before getting pregnant. Not before delivery, but before there's a medical confirmation that you are pregnant.
Right. So we made sure we got on a couple months before we were intending to start trying to have a kid. And then there's a lot of visits that happen before having the baby, and then there's the having the baby with you in the hospital, and then after having the baby, it's both of you in the hospital receiving care, and then after going home, it's all of the follow-up checkups for your child. So that can be kind of confusing, but really all that it has been for us is you pay that $1,000 to meet your first IUA, And then usually the hospital will bill you for all of your like care for the pregnancy and then your care in the hospital all in one big package. And so Zion asks kind of to get an idea of what that one big package price is to see if they can prepay for it. And if not, then they just pay it when it comes in.
Yeah. So essentially,
they cover you and they will cover all the costs for your child while in the hospital. And then being a direct member, and we'll kind of go through that, your child gets all of their preventative care afterwards. So that is another thing with Zion. You have to be a certain type of member in their program, and you have to be a member for a certain amount of time, obviously, before they will cover all of your kids' preventative, like immunizations at the 1 week checkup and the 1 month and the 4 months and 6 months and all of that. But all of our second child's and our first child's care has been covered under that initial $1,000. So
yeah. So when we had the girls, we paid $1,000 each, and that was it.
Yeah,
and that covered all the way up to like their 6-month checkup.
No, that covers up to their 24-month checkup.
Their 24-month checkup, people. So really awesome. Obviously, we've never had a kid using actual health insurance, but from what we've talked to other people, this seems like a really kind of easy, breezy, awesome way to do it, you know?
Yeah, it really is an easy way to have a kid. So there are just a couple things you want to read the fine print and look into and make sure you've got all your ducks in a row before you go ahead and start trying to have a child. But it's been really great to use.
Yeah, it was a great experience and still continues to be.
Yeah.
For sure.
So maybe we can move on to one of probably the biggest questions is just how much it costs so that you can kind of compare with other plans out there.
Yes.
Yeah.
Mm-hmm.
I'm going to pull it up because they have a couple different plans. Now, for Zion, they have something that's called an essential member and a direct member. And when you are a direct member, that means that you get all of the benefits that they offer or all of the programs that they offer. So they do have like virtual primary care that comes with being a direct member, and you get your prescription shared and a couple other benefits that you get. When you're an essential member, all you get is the coverage basically for a big emergency that happens. So you're not getting your annual visits covered or preventative things for your children after they're born, stuff like that. So we are a direct member, taking advantage of all of the services that they offer. And there's 3 different tiers you can pick from being a direct member. Look at the 3 different tiers. Yeah. And you can find this all on their website online.
Yeah, so this is all online, and their 3 tiers is really based off that initial unshareable amount. So remember, that kind of operates like a deductible. So what do you want to pay out of pocket before it starts kicking in? Mm-hmm. Obviously, if that number is bigger, then you pay less per month. So we have the most popular plan, which is their $1,000, but then they also have a $2,500 and then also a $5,000 IUA or initial unshareable amount. Mm-hmm. All of those will be that 3-month or 3 per rolling 12 months for your kind of out of pocket per se.
So we will have the most expensive plan per month, but pay the less out of pocket when we have a need. And even looking at their most expensive plan per month, it was better than our other options through our travel companies.
Right. And depending on if you're a solo, you just need this for you or just you and your spouse, or you and your children, or a family plan, that also affects on how much you pay. Mm-hmm. So we'll go off kind of what our plan is. The 1,000 IUA, for just one member, it's $185. For a member and the spouse, it's $350. For a member and their children, $350. And then for a member and family, so meaning husband both spouses and their children, that'd be the family plan. We pay $515 per month. So that's kind of like our premium we pay in per month. On their website, again, they have all of these kind of 3 different tiers. Go ahead and go there and check it out. We kind of gave you what tier we're in, which is, we're paying $515 per month for our whole family. Now, we fall in the youngest age bracket still, barely, which is like 18 to 29, which is a lot of travelers, actually. Usually you're either right out of school, kind of in this age bracket. But as you get older, the cost does go up. Very typical to health insurance. And so if you are older than that initial age bracket, your prices are going to be different, from 18 to 29. And then they go up every 10 years. So in your 30s, your 40s, and then 50s up to 64, because then after that you go on to Medicare.
Then we're just staying in our 20s forever, right?
That's right. So check that out if you don't fall in those brackets, because your price will be a little higher. Something to consider.
Yeah. But overall, it was a really great option for us cost-wise and what they cover. And for our lifestyle, we haven't found that we've needed them to cover more things.
No, it's been really great. And it gives us peace of mind, which is huge, because our family stays covered. All of our medical needs stay covered, no matter if we're on contract or if we're off contract. And that's one of the the beautiful things about being a traveler, is that you have an opportunity to end a contract and take extended time off. If you want to go to Yellowstone for a month, go to Yellowstone, but know that if you fall and, twist your ankle, you can get medical care because you're covered through that. And that really gives us peace of mind, especially now that we have, a young one that's running around.
And insurance seems to be such a big concern for people who are considering travel, especially if you have a family. That's going to be one of your biggest questions, is how am I going to keep my family covered for all of their needs that they have? And even if you're not a traveling healthcare professional, if you're just somebody who's trying to go and do your own thing, like be an entrepreneur, it's a really great option.
Right. Even we would say for solo travelers, I know we talk a lot from the family perspective, but as a solo traveler, I think this option would have been better for us, because then we could have... it would have been cheaper. It would have been cheaper, I think. And then if we would have taken extended time off, we were covered. And we could go do fun things.
We could have pocketed more of our...
We could have went mountain biking. We could have went rock climbing between, the contracts and still be covered. And not have to fall back retroactively on like a COBRA.
Right. Especially if you're wanting to take time off from working to go do fun, adventurous things. You don't want to be worried the whole time.
That's the point of travel.
Yeah. You don't want to be worried the whole time that I'm going to injure myself and need some sort of care, or let that fear keep you from going to do something because you're not covered. Right. So
hopefully this gave you a good overview of kind of what we do and why we chose a HealthShare for our medical needs as a family and as travel therapists. If you have any questions or we left something out, feel free to leave a comment down below or send us a direct message on Instagram, Facebook. If you're watching this on YouTube, again, leave a comment down in the comment section. You can also email us at ryanandmeganorear@gmail.com. We try to get back to those questions as fast as we can. And like this question that spurred this episode, you never know, you might ask a question and we might answer it on a full episode.
Yes. And if you found this helpful on HealthShares and you are deciding you want to go ahead and use Zion HealthShare, we would really appreciate if you mentioned us when you sign up as a referral. So we will have our referral number in the show notes. And if you are able to use that when you sign up, that would just be really nice if you got some benefit from this episode.
Yes. Before we go into kind of what's been good, what's been poopy, if you are looking to get into travel, you need a good travel recruiter. that is the base. That is where you want to start. And as always, we would love to share who we personally work with and trust. So go ahead and click the link down in the description. That'll take you to our website where you'll fill out a little form so we get to know a little bit more about you, so we can customize kind of which of our recruiters that we work with that we think you would meld best with. So if you're looking for some recruiter recommendations, please click that link down in the description.
Mm-hmm.
Okay, let's go into what's been good, what's been poopy.
Mm-hmm.
So what has been good for you?
What has been good? This week, Ryan and I have kind of implemented working out. Something that we always like to do when we have the time. We've really struggled to figure out how to do this with children and how to make it like a habit and, get to do it frequently, at least every week. So this week we've got 3 for 3.
Hey, we've done great, guys. We're very sore, which means we're doing good.
Yeah, we got some weighted vests to walk with because we do try to walk in the evenings if Ryan gets home before the sun is down with the girls. And because I'm not a fan of running, we walk. But I wanted to kind of add some resistance to the walking. So we got some weighted vests and use those tonight, which was fun.
Right. We have definitely been sore. We have used muscles that we haven't used in a while.
Oh, yeah.
And when you go into dad and mom mode, you feel exhausted, but really you haven't been moving as much as you think. Like you'll check your steps and you're like, wow, I've done 1,000 steps today and it's 9:00, and you feel like you've just been all over the place.
Yeah.
So as physical therapists, we want to take care of our bodies. So we've been trying to get into that, I guess, ahead of the New Year's resolutions or something.
Yeah.
We're trying to get ahead of the game, but
we have a beach vacation coming up in the
That's true. That's a good motivator.
Next year, so
that is a good motivator.
We want to be ready.
All right, what's been poopy?
Today was poopy. I took the girls to the laundromat to get laundry done before all the holidays and going back home. And I did that by myself last time we did that together. And by myself, it was just not it. So.
Yeah. If you've never been to a laundromat, we go to a laundromat because we are living in an RV and we don't have a washer and dryer here. Mm-hmm. Our campground does have a washer and dryer, like a coin one, but they just have one.
Mm-hmm.
So it is kind of nice to go to a laundromat and you have like a bunch of washers, a bunch of dryers, so you can just get it all done. But I cannot imagine you there trying to put in multiple loads of laundry. You have like one baby strapped to you, one infant, and the other one's running around.
I mean, just doing laundry would be difficult, but then you add on top like the kids got hungry, and then you add on top that you don't have enough money to do all of your laundry, and then you add on top that the laundromat doesn't have an ATM or a way to reload your card, so you have to leave and get more. And I'm like, that was a lot.
That seems like a team job for me and you to do next time.
Yep. So lesson learned. What has been good for you?
So what's been good is this past weekend, we got to go to a little town of Rosebud, Missouri. Mm-hmm. And a cute little town, only about 400 people, but they've changed a lot of the storefronts into little boutiques and antique stores.
Lots of antique
There's a
stores.
bakery there that we got some cookies from. We stopped at a little bar and grill and had a really good burger. And the drive out there was just really beautiful. So as you guys know, our home state is Missouri, but probably the one state we've traveled the least amount in is Missouri. Mm-hmm. And so we have just been amazed by we wouldn't call them mountains here, but
they
hills.
are Missouri mountains.
Missouri mountains.
For Missouri, they are mountains.
But very pretty views on the drive to this little town. And then it was nice and quaint, just a simple kind of one-day thing. And we could come back. The girls had a great time. It was fun to kind of mill around the little antique stores.
Yeah.
And so it was just a really great time and a good reminder of, think about what's around you. There's usually something that you can go do and find and have a good time.
And you got that recommendation from patients.
Oh,
Everybody kept saying.
Yeah, locals and patients when you're on travel contract are like a
Good
a
resource.
great resource for, what is something all the locals go to, or,
Yeah.
that we can do that you wouldn't know about if you looked on TripAdvisor.
I think that's something I've been the most shocked about at this contract is how pretty Missouri is. Like, I've lived here my whole life and I never knew this type of landscape really existed to the extent that it does. I knew we had some hills, but not like what we saw on our drive out there and what Ryan is seeing every day when he drives for work. So
yeah, it's really great.
Okay, what's been poopy?
I don't think I have any poopy things.
I won't be mad about that. That's pretty great.
Other than kind of the general, like, juggling life as a physical therapist, traveling as a parent, trying not to become overweight, like exercise and doing this podcast, and there's just a lot on our plates, and so I get a little stressed out about that.
Yeah,
because I want to do it all, because it's all good things,
in the day.
Right? And I want to accomplish more with that, but I can't do everything, so that'd be the only thing.
Yeah, if anybody's got some magic formula on how to do it all, share it.
I think that's the issue. There is no magic formula. All right. Well, that is it. I hope you enjoyed our episode today. If you could, hit that like button, consider subscribing to our YouTube channel, or again, leave us a review on our podcast, wherever you're listening to this podcast. And until next time, see ya.